Hello everyone, good morning. We are happy to have you here. Welcome to AAITP event and today's discussion on security in healthcare IT. My name is Hari and I'm honored to be your moderator for today's discussion. Rather than a traditional moderator-driven session, let's make this an active session and feel free to ask me or other panelists your questions. So let me introduce myself first. I am Harikrishnan Muthukrishnan. I'm a PEGA PRPC architect and administrator specializing in healthcare IT. I have over 20 years of experience in IT and certifications like PMP and CSA. So I have built expertise in software development, system architecture, production support, DevOps, and system administration. And I've been working with Fortune 500 clients globally. For the past decade, I have focused on PEGA, BPM, leading projects in design and upgrades, modernization platforms in healthcare IT solutions. As a IEEE member and BCS member, as I have been actively volunteer with ADP List and CodePath. So my passion include system administration, DevSecOps, and driving innovation in healthcare IT. So let's come back to today's discussion on security in healthcare IT. We have a truly distinguished panel for today's discussion, bringing together exceptional expertise and insight to enrich our conversation. So I will now invite each esteemed panelist to introduce themselves. Arpana.
Hi, thank you, Hari. As Hari mentioned, my name is Arpana Agarwal. I'm a senior IT auditor with 6+ years of experience. I hold the CISA, the CFE, and the data privacy credentials. I have excelled at safeguarding patient data and operational integrity in the healthcare industry. Over the years, I have navigated complex security and privacy regulations such as HIPAA, GDPR, PCI, and NIST framework, helping my organization to stay compliant and mitigate the risks. My areas of expertise include compliance, internal control optimization, cybersecurity strategy, governance risk management, known as GRC, identity access management, web penetration testing, and the secure software development lifecycle, to mention few. Prior to working in the healthcare industry, I was part of a big public accounting firm company that allowed me to serve nonprofit organizational, financial, manufacturing, and technology clients. A diverse portfolio of industries that I've worked with. I'm also very passionate to mentor and spread awareness of the importance of detecting and preventing any potential threats to sensitive data. Part of this role, I'm part of ISACA mentorship program, which allows me to motivate individuals through my experience and knowledge. I will pass it on.
Thanks, Hari. Thanks, Arpana. Hey, good morning, good evening, everyone, wherever which part of the world you are. I'm Fardeen Kazi. I'm a digital transformation expert specializing in healthcare administration, focusing on process automations, AI. I have almost 20 years of industry experience. Currently, I'm working as Associate Director of Digital Business Transformation and Healthcare IT at Cognizant Technology Solutions. I'm based out of Dallas, Texas. My main area of expertise is instrumentation, driving transformation across healthcare sector globally, basically focusing on the government line of business on Medicare and Medicaid services, where I have created solutions, created frameworks, process automation solutions for the clients, and implemented them across the spectrum from end-to-end automation. I also, as part of my volunteer activity, I am the Senior Vice President of Ethics and Compliance with the New World Foundation. I'm also part of the editorial board of IJGIS. Apart from that, I've been working as creating podcasts. I've been doing educational videos, specifically focusing on healthcare sector. I've also written numerous research papers and publications, as well as contributed towards book chapter. And I'm excited to be part of today's panel discussion. Thank you so much.
Thank you.
Yep. Hi, everyone. I'm Prashant Konle, a product leader passionate about leveraging technology to solve complex business challenges and deliver impact solutions. I've co-founded a healthcare IT company that was basically a physician practice management system. And from the start, security was one of the primary drivers of any decisions, particularly architectural decisions in the product. Over the years, I have developed and launched products that drive business transformation, operational efficiency, and compliance. Currently, I work in the space of governance risk control for defense and aerospace industry, and recently published a research article on enhancing cybersecurity resilience, particularly for healthcare organizations and how they can adopt security frameworks from non-healthcare industries and basically enhance their cybersecurity posture. The topic today of healthcare security in security is very pertinent, and happy to be part of this panel. Thank you.
Yeah,
Yeah, thank you, Prashant. Hey, hi, everyone. Good morning, good evening, wherever you are. This is Sibasis, and I am having around 17 years of IT experience on the software engineering side. I mostly uh, passionate about developing microservices, and my expertise is on the cloud performance optimization for fintech solutions. My most of the time in the industry spent on telecom domain, then I am switched to fintech domain, and I am also passionate about judging and also a speaker. I would like to thank AAITP to giving me this opportunity to speak about healthcare security. So I am looking forward for it. Thank you.
yeah. Thank you. First of all, thank you to AITP. This is Vijay Viradia, a technical project manager holding certifications in PMP, SAFE, Microsoft, and Certified Scrum Master, having a significant experience in digital health, medical device, and healthcare AI. I'm passionate about applying agile and project management methodologies to enhance healthcare coordinations, patient safety, value-based care, and healthcare equity. As a judge for the international awards like Fierce Healthcare, Globe, Vega, I evaluate AI innovations in healthcare industry. I committed to advancing responsible AI practices and is working towards contributing thought leadership on integration, agile in public health systems. And I would like um, to ask this particular esteemed panel one question that is coming in my mind about the data breach. So, team, what do you think the consequences of a data breach in the healthcare sector?
Yep. Let me take that, Vijay.
Thank you.
Firstly, yep. Firstly, in order to understand the consequence of data breach, let's first define what is a data breach. Now, a data breach is the unauthorized access, use, or disclosure of sensitive data, often resulting in harm to individuals or organizations. Now, in a healthcare setting, this typically involves patient healthcare records, their insurance details, their financial information, billing information, and so on and so forth. So what are the consequences if there is a data breach? The first thing is all healthcare organizations in this country are under mandatory regulations. So there are regulatory penalties. So they can range from for every data breach for a couple of $100 to $1.5 million and more. So there is a penalty from regulators. Second is financial loss. According to IBM Security Research Report, the average cost of a healthcare data breach is around $11 million, which is actually twice the amount for the industry, for the average across industries. So the financial loss is enormous. Legal liabilities are obviously given in terms of facing lawsuits from patients as well as other network providers. Reputational damage. So research has proven that anytime patients feel that their data is not secure, they will turn towards a different providers. So there is a reputational damage and future business damage. Operational disruption. I would say that in 2017, there was a ransomware attack in the National Healthcare Services in UK, due to which they had to basically stop or they were unable to provide appointment services and clinical services to the patient. So it not only affects their IT system, but the ability for that organization to actually provide services. And in healthcare settings, the time-bound provision of service is critical. So this kind of summary gives us that data breaches in healthcare have far-reaching consequences affecting patient trust, financial stability, and operational integrity. So now that we know that security is in healthcare is paramount and impact is enormous, I would like to ask the panel what measures can be taken to protect member and patient data in healthcare IT systems.
Thanks, Prashant. I can take that question. And thank you for explaining the consequences of data breach in healthcare. So before I dive into the measures, I want to set a context for the data first, right? So where the data is starting and how it is flowing through the system. So when you as an individual or your employer try to buy the insurance, right? They go to multiple agents or they go to directly to the health insurance provider and they submit your information, and that's where the journey starts. So you select the benefits, health, dental, vision plan, you submit your payment, the data flows through their enrollment system, and an ID card get generated, a member ID or group ID generated, you get a member ID mailed to your home. And then when you want to care, you go to a provider and then they start a claim. First, they check the benefits with the health insurance company. Once your benefits are verified, they start a claim, right? So the data starts from you, your employer, going to the health insurance system, reaching the provider, and then it's spread across the third-party providers, images, labs, in network, out of network system, right? So this is the whole span of data. Now, coming to how we can secure it, I have around 13 points. I think that is fundamental to our discussion that we quickly go through it, and then we can go dive deeper into more specific points. So for me, with my experience, I feel like number one is training, right? Educating the whole staff, doctor, nurses, and IT staff, developers, QA, everyone to what they can do to protect the data is important. So phishing attempts, social engineering, everything can be stopped by proper training. Two is encryption. So when data is going in transit or at rest, it has to be encrypted. Three is proper access controls. That is multi-factor authentication and secure the data or give proper access control for whenever somebody is accessing data. Four is audit trails. So have a very proper logs and who is accessing data when is very critical for identifying unauthorized activity. 5 is regular updates and patching. So all system has to be regularly patched and updated, have a very solid schedule built into your system. 6 is data minimalization. That means only keep the data that is required at that point. 7 is the best practices like DevSecOps. So whenever you are pushing a change, make sure you are doing a static scanning, dynamic scanning, penetration testing before it is released. So make that part of your release cycle. Role-based access. So set a role across your organization, who can access what, and that, or with a least privilege principle, means only allow what is needed in each role. 9 is secure networks. So have your firewalls, VPNs protected, and that is your first entry into your network. Regular security audits. So as part of the standards, every company, every organization should have an internal audit and an external audit planned in their system. And compliance with regulations like HIPAA and GDPR. Make sure you are compliant to it. And the one critical point that I want to mention is the type of data, right? So there are sensitive data, means FEP and state. Even if you have a person who don't have access to FEP and state access the data, that is again a security breach. So understanding the type of data and sensitivity is very critical. And the last is the monitoring systems using AI, because AI is a trend now. You can employ AI systems to monitor your system and identify the security measures that is happening. So now we covered the points. I'd like to ask the panelists, where do most breaches in healthcare IT system typically originate from?
Hari, I think so. Let me take that question. But thank you so much for the views, Prashant and Hari. I totally agree. We talked about the consequences of data breach in healthcare sector. We also talked about pardon me, what measures can be taken to protect the patient information, and specifically when we are dealing with healthcare, almost all data we have to assume and go ahead, like almost all data is PHI. It's highly secure, it's highly personal information. So that's where the information that's where it's very important to understand what are the sources and what are the origins of these data breaches, which we typically need to understand so that we can address and answer those questions. So we are looking at predominantly 3 to 4 key resources, basically around ransomware, phishing attacks. We are also looking at insider threats and vulnerabilities in third-party systems. Let me take each one of them one by one. I'll talk about the key ones first. One of the major ones which we are dealing in the healthcare sector, specifically the hospital networks, is the ransomware attacks. They are targeting the healthcare system, which can lead to immense data breaches, operational disruptions. The Most of the times this source is facilitated through weak security practices, and Hari rightly mentioned the initial firewalls and all needs to be secure and highly robust to ensure this is not attacked at the initial level. So I can give some few examples. We all know about the WannaCare ransomware attack in 2017, which in literally that got the UK's national health system, the NHS, to its needs. It's impacted more than 150 countries which were related to that network in Europe, across the globe. Another one which was here close to us in the United States was the 3 a.m. ransomware attack of 2023. It's a recent one, which has been indirectly linked to 144 deaths in the US. This was due to the network shutdown impacting the life support system, which bring us to the point like how vulnerable the healthcare system can be when such kind of data breaches and cyber threats occur. The second one which I talk about is the phishing attacks. Most of the time we are seeing the cyber criminals, they are often using deceptive emails to steal credentials. One example I can think about is in 2022, we had one of the major phishing attacks on one of the health networks, which led to unauthorized access and records to almost 600,000 patients. Similarly, we have insider threats. The insider threats typically involves when malicious actions or inadvertent errors by the employees. So we initially talked about the training requirements. This is where it comes into the picture. The employees, either they do it accidentally or probably they have some uh, malicious intent where they want to hack the system and then send it and share, or rather sell it across on dark web. So we typical example I can think about in 2022, Florida hospital employee, they improperly accessed and sold patient records for little monetary gains, and which highlights the needs for stringent access control. The last one which I think about is the third party vulnerabilities. So healthcare system, it typically deals with multiple stakeholders. Most of the time there is a reliance on external vendors which who can introduce risks, because we as a healthcare system, we can do all the robust measures of firewall protection, training, etc. But the third party stakeholders whom we are dealing with, if they are not up to speed in terms of cybersecurity measures, then it can breach the entire system. It can kind of open the floodgates for such phishing, ransomware, and other attacks. So similar act happened in 2022 when a ransomware attack on one of the eye care leaders. It happened, or the breach occurred through a third-party provider, which impacted multiple healthcare organizations. It exposed the vulnerability of vendor managers, how they need to handle the third-party stakeholders. Some other areas which I can think about is like the weak endpoint security system, the legacy systems, the software with fragile security protocols. And as Hari rightly mentioned about the measures which need to be taken, we have the training, which is very important. All the employees, not only within the healthcare system, but also the stakeholders, the third party, they need to be trained, they need to be made aware of these ransomware attacks, the phishing attacks, and how they can prevent those measures. Strict access control, as you rightly mentioned. One other thing which I just want to add is the vendor risk manager. That's a very important position, which all the organizations, specifically the IT organizations, where they are dealing with digital data transformation, handling and exchange of data, they need to invest in a vendor risk manager who can be a gatekeeper to ensure that the third-party vendors, they adhere to stringent cybersecurity standards. So those are my thought process here. We talked about the consequences. We talked about what measures we need. We also talked about where do these breaches typically originate from? One other question which comes up in my mind, and probably I just want to put it for the panelists, is where do you think these healthcare organizations should invest the most to improve their overall cybersecurity posture?
Yeah, Fardin, I think I can take that up. And thank you everyone for your inputs about the cybersecurity. As we know, like cybersecurity in healthcare is critical because it safeguard sensitive patient data and ensure seamless operations. With cyber threats becoming increasingly and budgets often limited for the hospitals, healthcare organizations need to make strategic investment plan. And I would like organization to check three areas where they should invest. The first and foremost is about endpoint securities. This includes securing devices like laptops, smart IoT devices such as connected medical equipments. These endpoints are often most vulnerable entry points for attackers. These endpoints are uh, deploying like this, like tools like endpoint detection and response, like EDR tools that can help to protect this device in the real time. I would like to have a second point in this area where organizations should focus is network monitoring and real-time threat detections. Today we have like AI. AI-driven solutions are available in the market. So AI-driven solutions are particularly valuable here as they can continuously analyze network traffic for suspicious patterns and detect anomalies early. These tools enable proactive responses to threats, significantly reduce the risk of data breaches. For instance, a properly implemented network monitoring system can identify unusual data, their flows, indicative or ransomware attack before it goes harm. Yeah. And the third point I would like to add, and Hari's also mentioned this in their 13 points, is about the staff training. So ongoing staff training and awareness program is must for all the healthcare systems. Many cyber attacks such as phishing succeeds because of human errors. And as Fardin said, like the issues in the last couple of years, and most of them, the root cause, if we can go towards that, it is like human error. Regular training sessions, including simulated phishing attacks, help employees recognize and respond appropriately to threats. We also like to add some policies, reporting mechanism to ensure that potential risks are addressed quickly to minimize their impact. Yeah. So I'm summarizing that like if investing in and the focusing these three areas, as per my view, healthcare organization can build a robust defense against a cyber threat. However, I would like to know from this panel how today's software world and the microservices and the latest software practices will help in enhancing this security and can help organizations to invest in that area.
Okay, I'll take that. Thank you for your question. Yeah, I think we are having a very great discussion so far, starting with the consequences of data breach by Prashant, and then on how can we do the protect the member and patient data from Hari, and then Fadin, a great talk about the healthcare IT systems, the breaches, and then Vijay slowly coming in towards how the microservices will help. So yeah, so that's a very buzzword, and all the industry is going towards the microservices cloud solutions, how it can help in any security threats, and mainly specifically healthcare, where it is very important to protect our data, right? I'll just have a brief summary on what it is and how it can help, right? So what is microservices? So microservices offer a service-oriented architecture that allows individual components of a larger application to function independently, right? So this decentralization can significantly enhance security in healthcare IT. How, right? So firstly, by isolating potential breaches to individual services. So what that brings in, so it will limit the overall damage of the attacker that can cause, right? Secondly, it allows more focused and efficient security updates. As Hari said, right, security updates are very important. So what happens in this case is, as each service can be updated independently without disrupting the entire system. So we have isolated the updates, so there is no problem in coming the healthcare industry completely down. Lastly, I want to bring that it also facilitates easier integration with security tools and technologies, like as each microservice can be equipped with its own security protocols, offering a multi-layered defense strategy. right? So this ability to integrate with advanced technology brings us a very interesting point of discussion, something that is called as a no-code or low-code platforms, how that can help us securing the healthcare application and data.
Thank you, Subhasis. I can take that question because I have been working in no-code, low-code platform for the last decade. And thank you for your insightful talks on microservices. So what is a no-code, low-code platform? So it is basically a software solution provided for using drag and drop and configuration to build your software solution rather than doing hand coding, right? So it's fast track your development, and it's been growing very rapidly nowadays with AI also in the picture. So now how it can secure your systems. The main point is most of the leading no-code platform has an industry-specific solution like healthcare or retail or finance. So they know the industry, they get the industry experts and build a solution in no-code platform which can be easily configured to fit your industry. So it is very faster development, and inbuilt security features are already there in the platform. So I would start with number one, built-in security features like out-of-the-box encryption, role-based access control, secure authentication like multi-factor authentication is already inbuilt. And they are already compliance certified like HIPAA and GDPR that we discussed about. Those platforms are already certified. And because the development is simplified, it reduces the human error, right? So most of the time you can code which is not generate a code that is not secure, but these platforms are generating the code by itself, so reduces human error. And other thing is automated testing. Most of the tools have automated testing, penetration testing inbuilt, which you can leverage and which reduces your security attacks. And also faster updates and patching. So most of the no-code, low-code platforms are provided as a software as a service in the cloud. So they take care of the centralized maintenance and patching. So it fast track the process and easier iteration. So because the development is very easy, you can, even if you identify a security breach, you can quickly react to it and fix it. So the iterations become easy. And role-based access control and data governance, we talked about it, and audit trails. So this tool has a very strong audit trail and logging built in, and a granular control over who can access and modify the data where. And also these tools have integration with secure ecosystems built in. That means the microservices that you mentioned, it is already built in, and the security is just enabling a tick mark, and you don't have to do a lot of hand coding. And all these systems scale with security because most of them are cloud-based and the security is built in. And one of the major thing I want to mention is empowering the non-technical staff. So because non-technical staff also involved in development, they are empowered to learn more and contribute more, and they are mostly involved in IT and understand the security things. So it reduces the probability of having attacks in these platforms. So now we discussed low code and low code platforms. The latest trend in low code and no code platform is AI. So I want to ask the panelist a question, right? What does AI does in healthcare IT security?
Yeah, and Hari, maybe I can take this question. And thank you for your insight on the low code, no code things. As like AI and artificial intelligence is transforming healthcare IT security by addressing challenges that traditional method struggle to manage. And that is the benefits that we are getting through the new inventions on the AI. AI provides advanced tools to protect patient data, secure critical systems, and detect threats more effectively than ever before. And I would like to put my points in the four different aspects, right? One of the most significant contribution of AI is the real-time threat detections. Right? Like unlike traditional rule-based system, AI learns from the patterns and adapt new threats. Like AI continuously monitor network traffic and user behavior, detecting anomalies that may indicate the potential breach. For example, it can identify suspicious logging attempts such as access from unusual location or devices and block them instantly. AI, second point like I want to add is the predictive analytics with the AI, right? That help organizations to stay ahead from the threats. By analyzing historical data, AI can predict potential vulnerabilities and recommend preventive actions. For example, it might highlight outdated software versions or unpatched systems that are likely to target for attackers. This proactive approach ensures that organizations can address weakness before they are exploited, enhancing their overall security posture. Third point I want to add, and that is a critical part, is securing IoT and connected medical devices. Devices like infusion pump or patient monitoring monitors or wearable health trackers, right? Often lack built-in security features, making them vulnerable to cyber attacks. AI can monitor these devices, communications within a devices, detect irregularities, and flag any attempts to tamper with the systems. And the fourth point I want to add, like AI simplifies compliance with regulatory standards like HIPAA or GDPR by automating audits and monitoring. It ensures that sensitive patient data is encrypted, access is restricted to authorized personnel, and logs are maintained and transparency. By automating these processes, healthcare organizations save times and reduce the risk of compliance violation. In summary, AI plays a pivotal role in the healthcare IT securities. As a cyber threat continue to evolve, AI offers healthcare organizations the tools they need to stay ahead and protect both patient data and the critical systems. AI is still evolving, but I would like to learn from this panel how cloud solution today is helping the IT securities.
Sebastian.
Sebastian,
Yeah,
you are on
thank you.
mute.
Yeah, sure. Sorry. I'll take the question. So, yeah, I'm enjoying the session so far. So, very good discussion we are having together. So, it's a great. So, cloud solutions, right? Yeah. So, cloud solutions and AI go hand in hand, right? So, let me talk about something on how cloud solutions help us and what are the benefits of having it in the healthcare IT sector, right? It has a various and numerous benefits in the healthcare IT industry. And one of the primary advantage is scalability, which ensures that the IT infrastructure can handle sudden surges in the demand, right? A common occurrence in the healthcare settings. And this is also coupled with cost effectiveness, which significantly reduces the financial burden on the healthcare providers, allowing for us on a more strategic allocation of resources. Moreover, cloud solutions provide real-time analytics, so which can offer valuable insights for better decision making, such as resource allocation, improving the patient's care as well. Right. One of the most significant benefits, however, it lies in the inherent promotion of the data centralization by the cloud solution. So if data is centralized in a particular place, then it is very easy for us to maintain the security and have audit on that. So this is very crucial for healthcare for the sharing patient data securely and efficiently. Now, all these advantages and everything what we discussed paves way for our next discussion topic, that is how the compliance with regulation like HIPAA is essential for healthcare IT security.
Thanks for the question, Sebastian. I can take that one. As I had initially mentioned, as part of my expertise, we had done multiple implementations for these digital healthcare solutions. One thing which we always ensured was we have a dedicated regulation and compliance manager or an subject matter expertise as part of our implementation team. Apart from that, we also invested when I was part of my organization when we are creating this total transformation solution for healthcare, specifically for Medicare and Medicaid, which are the government line of business. It deals with millions of data sets for the vulnerable populations about the seniors as well as the underserved population who typically do not have access to the latest advanced technologies, the tools, and the internet as well. So how their data is going across the and we talked about AI and cloud based solutions. Subhashish and Vijay mentioned about that. So the control as such does not really lie in the hands of the patients or even the provider systems who are managing that data. That's where we have these compliance and regulations pitch in, specifically governed by government or the federal agencies, which totally focus on the IT security aspect. So here we are talking about compliance with regulations like HIPAA. Let's talk about specifically about HIPAA, then I'll touch base about other areas as well. So which HIPAA is like, typically it's essential for healthcare IT security because it establishes a robust framework which protects sensitive patient data. And as I mentioned about, here we are talking also about vulnerable population who do not know where the data is getting transferred. So some of the key reasons which is very essential for regulating or initiating the compliance measure at a federal level is a few areas which I can think about is like protecting patient privacy. So HIPAA, they have got very robust patient privacy rules, which ensure that the protected health information or the PHI is only used and disclosed in authorized way. And it safeguards the patients from identity theft, discrimination, or financial fraud. So whenever the data is being accessed by any third-party system, the patient consent has to be taken. It also helps in mitigating cybersecurity risk. The security rule that mandates like technical safeguards, and we also talked about earlier, right? Hari mentioned about encryption, secure access, activity monitoring. It reduces the risk of data breaches or ransomware attacks, which we touched upon earlier in this panel discussion, which are typically the increasing source of data breaches and the cyber threats, which are targeting healthcare systems. HIPAA-like measures, they also help in avoiding legal and financial consequences. Because we know like these organizations, the payers, the providers, the third party system, the health entities who are part of the entire healthcare ecosystem, they have to bear the consequences. They have to own the responsibility whenever they are dealing with PHI. And in case they are non-compliant, it can the HIPAA-like agencies, they can impose severe penalties. We have an example where Anthem Incorporation, it paid almost $16 million in fine after 2015 data breach. It compromised almost 79 million patient records. And to tell you the impact of that, I was one of the members of Anthem's health insurance at that point of time, and not me, but some of my friends. They were paid like individually. They were each one of them. They were paid like almost $5,000 to $15,000 in compensation because of non-compliance as part of the $16 million in fine which was paid. So as we see, avoiding the compliance measure, they help avoiding legal and financial consequences, and it also shows like in case there is non-compliance and non-responsible behavior from these stakeholders, it can result in cost which need to be rather invested in adequate security measures rather than paying across penalties and fine at a later point of time. We also talking about like maintaining patient trust. I think so. One of our panelists talked about like what are the consequences, and one of the drivers of having robust cybersecurity measures in IT is maintaining patient trust, because patients, they entrust their most sensitive data to healthcare organization whenever they come for ailment as well as healthcare or health related discussions. So compliance measures like HIPAA, they ensure that the trust is upheld and demonstrate accountability, and they also ensure that proactive security measures are there. I'll just conclude by just saying like we have operational continuity, we are talking about reputational damage, etc. Apart from HIPAA measures, which we have here in US, we also have other stringent measures like the GDPR in Europe. One another point I'll just conclude by this point is I'm not sure like most of us we are aware. In India, we have a robust Digital Personal Data Protection Act, the DPDP Act, which was passed and enacted in 2023 for protecting patient health information and data privacy. I know like most of us might be surprised that we have such an act in India as well. The law has been passed, but what needs to be seen is how the law is really good in encompassing, but what is the gap in enactment and implementation, and probably what will be the penalties for non-compliance, because that is one area where we lack. So that was my thought process. I will also like to know, probably I'll ask Arpana to give her thought process, like what's her thought process in terms of compliance standards like HIPAA or probably the other compliance standards across the globe, how they are essential for healthcare IT security.
Thank you so much, Ferdinand. As being an IT auditor, I guess it's so good to hear but how the other groups in the organizations in the healthcare industry try their best to keep up and comply with the regulation bodies that are out present. Me being an IT auditor, I come wearing my cop hat and audit, you folks in different departments within the healthcare industry. I know Ferdinand has touched a lot about HIPAA, right? I will do a little bit of high level on HIPAA and then touch the NIST, which is the National Institution of Standards and Technology, which is known as the cybersecurity framework, the guidelines that we use to audit. So I have 5 in total. The third one I want to touch base is the PCI, which is the Payment Card Industry Data Security Standard. The other one is Health Information Technology, which is the HITECH Act, which is primarily in the US, and then GDPR, which was founded in the European Union. I will say how that all these touch us as a healthcare industry. HIPAA I consider as an umbrella. So it is the overarching regulatory body that protects the sensitive patient health information. It mandates safeguarding the patient data, both physical and electronic, including any infrastructure that carries the sensitive data. HIPAA compliance rules are primarily around security and breach notification. It highlights the importance of encryption, data access control, regular audits, and training for healthcare providers and associated entities. And that's a lot that we touched. Hari and Prashant both touched these items. NIST is what I work off, the cybersecurity framework that provides the guidelines on how to safeguard patient data and assist organizations to comply with HIPAA. Not only HIPAA, but also GDPR and PCI. So this framework takes a tactical approach to cybersecurity risk through identifying, protecting, detecting, responding, and recovering. Just to give you a little bit of one-liners for these, when you mention about identifying, that's understanding and prioritizing the assets and the risk associated with the healthcare industry or any, I would say, patient data or infrastructure. Protecting would be the safeguard operations with the effective controls, what controls are currently in place. Detecting, staying ahead of identifying any threats that are going to be arise of any tool involved or any new process that would be introduced in the organization. Responding, how are we handling the incidences and how effective those are and how real time they are. Recovering, what are the backup plans, right? And the disaster recovery plans, I would say, that we have in place for the organization. Again, adopting NIST is a very key important that helps protect organizations from cyber threats. Again, mentioning these regulatory bodies are very important. They're not nice to have, but they're mandatory to have. Just to go over PCI, that is related to card data protection during payment processing or any credit card transactions that happen. So this is around the encryption data, the control access points, and the network that prevents the fraud or detects ahead of time. And all these PCI, NIST, they constantly keep upgrading every year to meet the cybersecurity risks that are emerging in the year as the AI is also rapidly coming through. HITECH, again, this is just another arm of HIPAA, right? This is just supporting and expanding the scope to entities and business associates related to that organization. GDPR, nothing new. This is like over the Europe side, or if there is an organization that has connections or hospitals or any data being, communicated, then how are we protecting that data of the EU residents? and how is it being processed or how is it being transmitted. So all these has their guidelines that we used to follow. I would like to understand from the group, when does compliance with security framework like HITRUST and NIST become mandatory for healthcare providers?
Yeah, let me take that, Arpana. I think you and Fardeen have rightly touched upon the HIPAA and the overarching framework it gives, as well as high-tech GDPR. But one of the things which happens, as I see as a person who's actually implementing and solving business problems, I have the need for security. There are frameworks which are given by regulatory body. How do I implement it? So guidelines as a product person is not enough. What an organization needs is a prescriptive framework to adopt and a way to actually audit yourself through third-party assessment, saying that you are certifiable, because it gives a signal to the outside world that security is a paramount for your organization. So I'm going to talk about two frameworks which healthcare organizations can adopt. One is called HITRUST, which is Health Information Trust Alliance. And this is a certifiable framework to basically design to tailor to tackle the complexity of cybersecurity and compliance in healthcare. This is a very popular framework which has been co-opted by in other industries as well. Just to give a kind of a guideline, you can say that if I look at the HIPAA guidelines, it will say that the entities are required to implement reasonable safeguard for data protection. Now, but what constitutes a reasonable safeguard can change from organization to organization. It leaves room for interpretation, but frameworks like HITRUST gives very detailed implementation requirements, which third-party assessors can come in, basically evaluate. The implementations can be very specific to encryption protocols, access control, reducing ambiguity. So that helps basically organizations adopt and implement these security posture much more easily, much more, I would say, on an ensured and definitive pathway. That's why these kinds of frameworks are very important. The second framework I would like to talk about is called CMMC. This is a Department of Defense regulated framework, basically for any contractors or defense organizations who are in contract with Department of Defense. Now, this is a brand new framework, which was basically published in October 2024, and most federal contracts by DoD are going to require that CMMC be the any organization who is kind of bidding for contracts be CMMC certified. Now they provide different levels based on organizations capacity and levels from level 1 to level 5, and they have I'll say close to 110 controls which organizations can actually implement. Now the reason why this is very I would urge healthcare organization and entities look at is because it looks at risk in the supply chain, not just the internal, but the external supply chain. Now, in case of healthcare industry, the supply chain involves vendors, suppliers, third-party providers. So there is a lot of data exchange going. So what it mandates is the security posture is rigorous controls in terms of data exchange, the quality of what is accessed is across the entire supply chain value system. So so that means that your posture is actually driven and percolated through entire supply chain, and they have enhanced security controls where you can be confident that your security is as tight as your supply chain, or there's no weak link asset. So that is a framework which I definitely want any healthcare entity who's particularly vulnerable or serious about cybersecurity to really look at how they can take parts of it and take the prescriptions out of it and implement that framework into their IT security posture. Now that we have looked at kind of how the different security frameworks and its importance, I would like to go back to Arpana as a CISA who has done a lot of audits. When should healthcare organization actually conduct these kinds of assessments?
Thanks, Prashant. This is a very good question. When is always a unanswered question, right? And I guess what a lot of, I guess I would say, gap or failure to know the exact answer when should a risk assessment be performed or at what point is a very subjective base, right? As an auditor, I refer to a risk assessment as a health checkup for a business infrastructure, right? It's when we do a risk assessment, it's a complete evaluation that identifies any vulnerabilities or weaknesses in systems and data, even infrastructure, processes, or departments, right? Or gaps, I would say. This assessment assists in proactive steps to mitigate potential threats. Or I wouldn't even say the severity for threats, right? Could be any gaps that we have within the process. A cyber risk assessment, pinpoints and evaluates, also ranks threats to your most critical assets. It also covers your physical infrastructure, people, processes, third-party relationships, and the potential impact of your reputation or operations. Not to forget, it's a mandatory for all regulatory bodies that a risk assessment needs to be performed under the cyber risk assessment because it's disclosed in the financial statements and footnotes under cyber risk assessment. And also in the HIPAA, a risk assessment analysis under 45 FCR. Excuse me. Again, coming back to the question when, I say regular periodical risk assessments are a necessity for the compliance and for an organization. Again, I've already touched base, and most of you have also touched base. Failure to do that, you could face hefty fines, legal challenges, and significant reputation damages. I kind of want to sum up my importance of risk assessment through a recent CrowdStrike patch outage that we had on July 19, 2024, a very recent example. This was caused by an internal issue with a software bug update. In my words, I would say that the immediate effect obviously was the unavailability of hospital systems, right? And I summed up this as this incident occurred due to a lack of security assessment over the CrowdStrike vendor as a change management process, right? If this instance had a proper assessment done, right, they could have assessed the vendor risk and mapped out the critical third-party relationships, any gaps or any risks that came with CrowdStrike. When third-party vendors evaluate the provider's cybersecurity protocols, and then we could identify the type of data that reside and what access points the vendors have, right? Again, and then come up with mitigating results or the continuity plans that we have in those gaps. It is very important, and I know we mentioned about vendor risk assessment, that Fardeen mentioned about vendor risk assessment. That's part of a very key important part that we need to perform when we onboard a vendor, a third party, right? We need to understand this. In conclusion, we see that healthcare businesses are constantly increasing with the use of digital platform, and the risks associated with cloud environments, AI, and evolving regulative frameworks are leading risk assessments to play a vital role in safeguarding and meeting compliance. I would, move and ask Hari, what are the most vulnerable points in a healthcare IT application infrastructure that you would consider that could be, you could perform a risk assessment around?
Thank you, Arpana, for sharing the audit insights and the standards that we need to follow. So I want to just quickly go through the most vulnerable points because actually we are very close to the time allocated for us. So for me, the most vulnerable points in healthcare IT are endpoint and devices. That means the computers, mobile phones, medical LOT devices where users access. That is the main point that it can get vulnerable. Second is legacy system, right? Most of the healthcare organization have a legacy system that is outdated, not patched. They are just limping along in before it can be modernized. Those are the second point for security breach to happen. And data in transit and storage. whenever data is in movement or in storage, there is a possibility that it can get exploited. And human error, right? Social engineering, phishing emails can actually make mistake. People can click on the link and make mistake. And insider threat, right? Whether it's intentional or accidental, can cause a significant risk. And as we are all, Fardeen and Arpina mentioned, third-party integrations, where you share the data with third party, and if they are not careful or don't have security policies, you can have breach there. And network security means if you have a misconfigured firewall or unsecure Wi-Fi network, you can have issues. And other thing is making changes to your software or hardware. So whenever you make changes, that is a point that you're opening up for security issues. So DevSecOps pipeline for whenever there is a software change, and good auditing in place before making changes to the infrastructure, network, VPN is a measure that you can take to safeguard it. And with that, I like to conclude our session. And thank you everyone for sharing your insights. And it is very insightful. Prashant sharing his real, and Fardeen sharing your real life examples that you have gone through, and Sebastis, your microservices, architecture and cloud solutions, how it can help, and Vijay, your investment strategies and AI. It was really insightful. And Arpana with your auditing techniques and standards, right? So thank you all panelists for sharing your forward-thinking insights. And it's fascinating to hear how security in healthcare is expected to evolve with the next wave of trends and innovations. You all have different backgrounds and opinions, and we are privileged to hear from you today. And thank you very much, audience, and enjoy the rest of your day. Goodbye, everyone.
Yeah.
Thank you.
Thank you.
Thank
Thank you,
you.
everyone.
Thank you.
Thank you,
Thank you,
Harshad.
AITP.